So now we're going to go back into order. I know Mark had to run. That's why we were
Don't run,
moving
Mark.
him up.
Just
Not
walk.
running, walk.
Yeah, we need you tomorrow.
We're back to Carol Ann Lemon, who is representing the New York State Nurses Association. Hi, Carol Ann.
Hi. Good afternoon. On behalf of the 37,000 registered nurses of the New York State Nurses Association, I'd like to thank you for the opportunity to testify. New York's nurses know as well as anyone that our planet is sick. The diagnosis is a climate crisis, and the cause is our economy's addiction to fossil fuels. We know this because we have seen the symptoms up close. When Superstorm Sandy tore through New York, destroying homes, breaking up communities, and killing hundreds of people, nurses were on the front lines. Nurses were there to evacuate people from hospitals. Nurses were there to fill in the gaps where traditional relief efforts were slow to respond. Nurses were there going door to door in some of the hardest hit neighborhoods with aid supplies. Nurses were there to ensure that isolated residents got the medications they required. Nurses were there to care for New Yorkers in their time of greatest need. We know that the type of flooding that Sandy brought to our shores will only get more common the more carbon we pump into our shared atmosphere. The increased evaporation of water is like fuel for storms, turning hurricanes into superstorms. Not only that, but seas are rising at the fastest rate in the last 28 centuries. The fastest rate in 28 centuries. But flooding is hardly the only weather hazard of the climate crisis. Weather of all kinds is getting more extreme. The climate crisis means worse blizzards. It means worse heat waves. In recent years, a drought has wreaked havoc on this continent, blighting our country's crops and drying up its water supply. At its peak, more than 4/5 of the U.S. was covered in abnormally dry conditions. And historic drought means historic wildfires. In 6 of the last 10 years, the U.S. Forestry Service has emptied its Congress-allotted budget fighting record-breaking wildfires out west. These conditions may seem far away from Albany, but they profoundly threaten our food system and the livelihoods of our fellow nurses and fellow Americans. Moreover, the climate crisis accelerates itself in a vicious cycle of warming and melting, so Western-seeming problems may be at our doorstep before we know it. For addressing this crisis, the time is up. We know the solution. In order to keep climate change to 2 degrees or 1.5 degrees Celsius, we need to keep 80% of the remaining fossil fuel reserves in the ground. Those reserves already appear as assets on the books of fossil fuel corporations. We have to cancel out those assets in order to save this planet. As NISNA President Judy Sheridan Gonzalez said at the People's Climate March, we need a system change to deal with climate change. And that means taking on the fossil fuels industry. And that's where the Fossil Fuel Divestment Act comes in. This act says that our pension funds will no longer feed the beast that's killing us. It says that our collective assets will not be used to invest in the companies destroying our collective atmosphere. It says we will not tie up our savings in assets we know are going to have to cancel out in order to save this planet. It says we as a state are prepared to stand up for future generations of New Yorkers against the profit-hungry corporations who would rob them of their birthright to a healthy environment. Fossil fuels are hazardous for reasons beyond just wrecking our shared climate. They pose special dangers to people who live and work near them. Every year, thousands of hospital admissions in New York are due to asthma, pneumonia, chronic bronchitis, and other respiratory ills that are directly attributable to our dependence on fossil fuels. Just last year, Comptroller DiNapoli's office released a report on the high cost of asthma-related Medicaid expenditures, which have risen 26% in the last 5 years. That figure now stands at $1.3 billion per year. NYSDA nurses were thrilled when Governor Cuomo banned fracking in our great state, but we remain distressed that so-called bomb trains, which have blown up and killed dozens of people, continue to carry volatile fracked oil in totally unsafe conditions past schools, hospitals, and local communities throughout the state. Everywhere you look, fossil fuels are endangering us. Fossil fuels choke our lungs. Fossil fuels blow up our towns. Fossil fuels rise our sea levels. Fossil fuels worsen our heat waves, droughts, fires, and storms. It is time for New York to stand up and say, not with our money.
Bravo.
Thank you.
Carol, I really would like to thank you for your testimony. It cannot be more loud and clear. Because go back to what the doctor was speaking about, the health issue. This is a health issue, as well as an economic issue. But it's impacting our kids, impacting the healthcare system, and that is the reason why we have so much high cost on the healthcare that is unfunded. So thank you for your testimony, and I hope you can speak like that another time as well. Thank you. Thank you.
I also want to thank you. I mean, I thank you and Tony's testimony side by side. Tony was talking about, bad pun, the global impact of the economic negative consequences of fossil fuels, and that needs to be factored in to when we're doing our cost-benefit analysis, a great government term, of how much we're making versus how much we're losing. But I think that Carol brought it home to us about the human impact of the damage done by climate change in very real terms, and of course highlighting as well that the cost to the public for increased public health crises brought on by our decisions not to address climate change not only are dramatic and devastating, but it only gets worse if we don't reverse ourselves. And so I appreciate both of your testimony, but I think particularly from the perspective of nurses seeing the health impact, it's a very important, powerful, I guess, piece of the story that it's important to keep on the table. So thank you very much.